We have two prescription drug shortages to tell you about tonight. The FDA is warning about a shortage of a popular asthma medication, Albuterol. A major factory recently closed, leaving only one manufacturer of a liquid form of the drug, most often used in nebulizers for young children. Traditional inhalers aren't impacted. And Adderall, which is used to treat ADHD, is also in short supply, leaving people scrambling and struggling. CBS's Meg Oliver takes a look at what families can do.
What does the sheep say?
She say bye.
Emmy Weed is juggling caring for her two youngest sons while she works from home in Huntsville, Alabama. She's also struggling to find Adderall.
And my brain feels like a jumbled mess of an inability to prioritize what I need to do. It's like a to-do list with no number on it.
She, her husband, and their teenage son, Leo, all take Adderall to treat their ADHD.
How is he struggling?
He's struggling with the impulse control, the doing flips on the bus, the getting in trouble. He's struggling with wanting to do things like you would see in regular depression, go out with his friends, be interested, clean his room, interact with his siblings.
The FDA announced a shortage of the active ingredients in the drug Adderall in its generic form last October. The agency told CBS News it is working closely with manufacturers and others in the supply chain to mitigate and prevent or reduce the impact.
Any idea why this is happening?
There's increased demand for these stimulant medications. That happened during the COVID pandemic. And it also became easier to get prescription medications because of the introduction of telemedicine and telepsychiatry.
Prescriptions for Adderall have risen almost 35% in the last 4 years. More than 40 million people received monthly prescriptions in 2022.
I have so many questions about
Families like the Wheats are rationing their supply.
I think everyone wants to take their medication how it's directed, but we're being put into a position where it's very difficult to do that. So what do we do?
With the drug shortage expected to last until at least April, experts advise patients consult with their provider on alternative treatments. Meg Oliver, CBS News, Hackensack, New Jersey.